Hi everybody. Yesterday we were doing some exercises with a patient of ours. This patient originally came in because he strained his low back about 2 weeks ago. And with 2 weeks of care with chiropractic adjustments and active release technique, we've effectively restored the mobility in the lumbar spine and broken up a lot of the scar tissue, the adhesions in the low back. He mentioned yesterday that his buddy was teaching him some barbell movements in the gym to help strengthen the low back. I was very curious about this, so with the PVC pipe, I had him demonstrate, and this is what it looked like. Now, I may be exaggerating a little bit, but not too much. So I explained to this patient that as long as you continue to do that movement in the gym, you're going to be a patient of ours during acute care for quite a while, because you're just going to keep re-injure that low back. So we wanted to switch that up, get rid of that movement as quickly as possible. So I went through the Romanian Deadlift with them. The Romanian Deadlift is a great movement. It's pretty much one big exaggerated hip hinge with an external load. I didn't want to take him through the full deadlift with the knee flexion as well. So we wanted to keep the weight light, and we wanted to keep the movement simple. So the PVC pipe, how we're going to do this, we're going to start legs about shoulder width stance. Weight's going to be on your heels throughout. For your arms, the distance, you're just going to put your thumbs up and just until they touch the outside of the thigh, and then back. So you're going to keep that chest open, shoulders pulled back. You're going to keep the arms nice and loose, so you can see the elbow pits are facing each other, so they're not really tight and facing forward, but just nice and loose. Your arms are just ropes right here, just holding the weight. So you're going to slowly push that butt back behind you. Let that bar slide down your thighs, over your knee joint, past the patella. And then you're going to slowly reverse that motion and squeeze the glutes to the top. You're going to keep the neck in a nice neutral position. So you're not going to be in a big hyperextension with the neck, but just let it relax. Go down with the bar. So from the side, and how far do you want to go down? Ideally, you want to go to about mid-shin, so that back is about parallel to the floor. But you don't have to start doing that right away if the back isn't ready. So you can just come all the way down, past the knee to about right here, and reverse that. With the knees, there's not going to be much flexion to the knees at all. You're just going to have soft knees, so just unlock those knees. Again, keep the weight on the heels, and at that top position, you're going to squeeze the glutes. So get that triple extension with the ankle, knee, and hips, about right here. So we're not looking for any hyperextension here. We're just going to come down and squeeze. With this patient, he has a pretty strong base. He's been lifting some weights for quite a while. So I'm going to have him start maybe once or twice a week with the Romanian Deadlift at 12, 10, 8, 6 repetitions. So 4 sets. I would have him start just with the 45-pound bar and then slowly increase that weight. I'm seeing this patient again this week, so we're going to kind of go through technique again, see where he's at, see if we can tweak anything else. The most important message of this video, besides the technique for the Romanian Deadlift, which is an excellent exercise, is that there's a lot of bro advice out there in the gyms. If you go to any 24-hour fitness, anytime fitness around 5, 6 o'clock, you'll just see a horror show of what not to do. So be sure that whoever's giving you advice in the gym is a certified personal trainer, a physical therapist, a chiropractor, someone who's qualified to be giving you this knowledge. And if you are not familiar with these exercises, it's very important that you seek out a trainer or a coach or a healthcare professional to really guide you with this. That's the most important thing we can really say. So don't be one of the bros in the gym, just flailing wildly. All movement should be controlled, and you should have a design goal and purpose. All right? So if you guys have any questions at all, be sure to reach us at 303-300-0424, or you can visit us online at denverback.com. Thanks, guys, and have a great day.